Hi, this is Boobology with Dr. Momo, where we feed tiny humans one boob or one bottle at a time. No judgment, whole lot of love. All right, we're going to talk about one of the biggest concerns we have in the first week. Your baby won't latch. What's going on? All right, you're panicked, you're frustrated, and you're Googling for answers. But don't worry, you're not alone. This is super common. Here's a list of reasons of why it can happen and what you can do about it. All right. First of all, your newborn is still figuring everything out, like literally everything. When they're first born, they don't know how to latch properly. Their reflexes are still developing. They just don't have it figured out yet. All right. The number one thing is poor positioning. Sometimes it's not the baby, it's just the angle. So kind of keep playing around with things. All right. The next is engorgement. You've got all that milk that comes in day 2 to 5, and it's just hard for baby to grab onto that rock hard boob. Check out my video on engorgement. All right. And maybe it's low milk supply, but probably not. Like almost never is that what's going on. All right. So here's some things that you can do. Get the right position. Positioning is everything. Again, check out my video on that. All right. Try skin to skin. It's so important. It calms you down. It regulates baby's heart rate, temperature. It's just it's just magic. Okay. All right. Express some milk. If you don't know how to do that, check out my video on that. Maybe you need a nipple shield, but probably not. Again, check out my video, reach out to a lactation consultant for help with that. Most important, you want to stay calm and patient. You want to regulate your stress hormones if you can. And if you've tried all of these little things, you've done the research and you still can't get it to work, ask for help. Reach out to a lactation consultant or a pediatrician that's trained in these kind of things. If baby is still struggling or you're in pain, breastfeeding should not be painful, then you need to get help. A lactation consultant can observe your latch, offer advice, and identify any underlying conditions. The takeaway. All right. Don't freak out. This is normal. Most breastfeeding parents go through this. It's a learning curve. Baby's figuring it out. You're figuring it out. You guys can get it. Ask for help. All right. Until next time, do good. Kiss the baby. Love yourself. Toodles!